Today we will be discussing, just watch. This video is about induction of labor, which is defined as stimulation of uterine contractions before the onset of spontaneous labor. There are several indications for induction, for example, hypertensive disease in pregnancy, placental abruption, intrauterine infection, also known as chorioamnionitis, fetal demise, premature rupture of membranes, post-maturity, maternal conditions like diabetes, and fetal compromise like intrauterine growth restriction. On the other hand, there are a few contraindications like placenta previa or vasa previa. I will cover those topics in a separate video. If the baby is in transverse lie, history of classical C-section, and in the presence of active genital herpes. Cervical assessment is done by calculating Bishop's score. It has 5 components, and if the patient scores more than 8, the cervix is considered favorable with a higher chance of successful induction. Induction of labor can start in clinic by performing membrane sweep. This is achieved by inserting a finger through the cervix and rotating it to separate the membranes from the uterine wall. There is a risk of accidental amniotomy or bleeding if there is an undiagnosed placenta previa. Mechanical methods are available, and the most common one is by inserting a Foley valve in the cervix, which is a relatively safe procedure. When the cervix permits, amniotomy, also known as artificial rupture of membranes, can be performed. There is a small risk of cord prolapse, chorioamnionitis, and rupture of vasa previa. The medications we use for cervical dilation include dinoprostone, which is prostaglandin E2. It is inserted in the vagina in the posterior fornix. The other one is misoprostol, which is prostaglandin E1. It is contraindicated in a history of a previous cesarean section. We can also use an infusion called oxytocin to stimulate uterine contractions. If you want to see more videos like this, please like and subscribe, and you will be notified when a similar video is posted. See you next time.